Hello. Let's talk about a common problem in older adults that can feel scary, but becomes much less confusing once you understand it. Imagine this. You're fine sitting down, but walking to the kitchen suddenly feels like climbing a hill. You notice a dry cough. Maybe you can't lie flat comfortably. That pattern often leads to one finding on a chest X-ray or ultrasound: fluid around the lung. That's called a pleural effusion. Your lungs are wrapped in a thin lining, like two smooth sheets that glide as you breathe. Between those sheets, there's normally just a tiny amount of fluid for friction-free movement. A pleural effusion means there is too much fluid there, enough to crowd the lung and make breathing feel harder. Here is the key point. Pleural effusion is usually not the main disease. It's a sign that something else is going on. And in older adults, more than one cause can happen at the same time. So the goal is not only remove fluid, but find the cause and treat it early. Most pleural effusions in adults are linked to four major categories. Heart failure, when the heart's pumping pressure leads to fluid backing up. Infection, like pneumonia, where inflammation pulls fluid into the pleural space. Cancer, especially lung cancer and breast cancer, which can irritate the pleura. And blood clots in the lung, pulmonary embolism, which can also trigger fluid. There are other causes too: kidney or liver disease, tuberculosis in some regions, autoimmune conditions, but these four explain a large share in real-world practice. Doctors often start with one practical question: is this pressure-related fluid or inflammation-related fluid? Pressure-related fluid is often from heart, kidney, or liver problems. Inflammation-related fluid is often infection, cancer, or clots. If the cause looks obvious, like known heart failure with typical swelling and both sides involved, doctors may first treat the heart and watch the fluid respond. If it's new, one-sided, large, unexplained, or you have fever or chest pain, they often test the fluid. One common procedure is thoracentesis, using a thin needle to remove some fluid for testing, and sometimes to relieve breathlessness. Today, the standard safety approach is ultrasound guidance. It improves success and reduces complications like pneumothorax, air leaking into the chest space. The fluid can then be tested to help identify infection, inflammation, or cancer cells, and to guide next steps. If an effusion is related to pneumonia, clinicians are careful to rule out a complicated infection in the pleural space, an empyema, because that may require drainage plus antibiotics. That's one reason prompt evaluation matters. Delaying the cause can increase complications. If the effusion is malignant and keeps coming back, management often focuses on comfort and quality of life. Two common options for people who are symptomatic are chemical pleurodesis, often using talc to help the lung lining stick together and reduce reaccumulation, and an indwelling pleural catheter to drain fluid at home over time, especially if the lung does not fully re-expand. The best choice depends on the individual situation and goals of care. Please treat these as urgent reasons to get medical help quickly, especially after 60. Severe or rapidly worsening shortness of breath, chest pain, fainting, new confusion or blue lips, fever and shaking chills, very low oxygen readings if you measure at home. These can signal infection, a large effusion, a clot, or a heart problem that needs prompt treatment. Let's recap in one sentence. Pleural effusion is extra fluid around the lung, and the safest path is to identify why it's there. The good news is that clinicians have a clear diagnostic roadmap: imaging, ultrasound, and when needed, a safe fluid sample to guide effective treatment. If you or a loved one has been told there's fluid around the lung, ask a simple question. What is the most likely cause in my case, and what is the next step to confirm it? Thank you for watching. Stay informed, stay calm, and don't ignore breathing